Hey everybody, Amanda Olson here, Master Mom, and I'm with Olson's Martial Arts Academy here in Johnson City, Tennessee. And today as my guest, I have Dr. Kim Contryman. She is also a very good friend, and she is a exceptional martial artist. So she has a lot of really neat qualities about her, and at this time I'll go ahead and let her introduce herself and her credentials. And Dr. Countryman, I would really like you to tell everybody what your specialty is in, what your doctorate is in, things like that.
Sure, sure. Well, first of all, thank you for having me. I appreciate it, and it's always an honor to be asked to come and speak and have discussions about my passion, which is physical therapy. So that's what my doctorate is in physical therapy. I am not from here. I grew up in Phoenix. I went to PT school in Flagstaff, Arizona, and I got my master's there. Then I started interviewing around the country, and I fell in love with Tennessee because it's green and there's trees on the mountains. And so I moved out there. I started working in a rehab facility. Then about 3 years into it, I ended up working at another facility. I went over as director of PTOT, speech, rec, and psych. Worked in middle management there, and along that way, I ended up working with some great therapists, and I ended up sitting for my boards in neurology. So I am certified in, from a physical therapy boards, I'm certified to treat neurologically involved clients. And since then, I've had to recertify for 2 times. You have to certify every 10 years. So now I'm starting to show my age a little bit.
Yeah, okay, getting some truth.
That's right. So then about 9 years in, I left because I felt like I needed to know more, and I had an opportunity to open up my own clinic, but I was going to be out on my own. So I really felt like I needed to know more. So I went back to school to work on my doctorate, and I moved out to LA. Drove out there with my dog and cat, didn't know anybody, and had gotten accepted there in their clinical doctorate program. So while I was there, I got to teach at the university, which was great because it paid my tuition because it's very expensive out there. So I taught and took classes. And then on the days I wasn't doing that, I worked in a small clinic in Beverly Hills. And so while I was there teaching, I ended up sitting for my boards in orthopedics. So I'm also board certified in orthopedics and have recertified as well in that. Moved back to Tennessee, opened up my clinic, and we've been there since 2002. So we see a lot of different clientele. My youngest has been 2 weeks old, and my oldest has been 99 years old.
Oh,
So
wow.
wide range in ages.
Yeah.
See all sorts of people with different diagnoses, from orthopedic issues to people who've had strokes, Parkinson's disease, multiple sclerosis, brain injuries, spinal cord injuries. So it's a little different in our field in that we have a different approach. From a lot of times in physical therapy, you have this delineation between orthopedic therapists and neurotherapists. And with this, I really try to incorporate my specialization with ortho and neuro with all of my patient care. Because that's how the body works. We have different systems, but they have to work together. Mm-hmm. And it's been very successful for me, and patients have done well, and I love it still. And I feel very blessed that I wake up every morning and I'm excited to go to work. And I don't think people get that after 25 plus years.
Yeah, so. I know that's something that we've shared. You know, we have the same excitement each day when we get up. We enjoy being able to go to work. And right. I know just from not just a friend's point of view, but from a patient's point of view, you've helped put me back together a few times. And so I appreciate that, and my husband and my son. And I think the only one, Katie, hasn't had
any. One more to go. Yeah. Although it's never working for us, so that should
knock on wood that, yeah. But yeah, she takes better care of herself than we do. Let's go ahead and that's quite a resume, and you do get to work with a lot of different folks. And how long ago was it that you started martial arts? Because you started here at Olson's Martial Arts Academy. I think your daughter started first, and then you started after. Both of your daughters started.
Right. So both my kids started when Briley was 3. So it's been about almost 8 years.
Yeah,
So
yeah.
almost 8 years. And so I had 2 kids who needed to get, I felt, well, I really didn't know much about martial arts at all. But I had 2 kids that were quite different. I had one who needed some self-discipline and one who needed some self-confidence. And so I stopped by. I ended up talking with your husband, Master Glenn, and he showed me around. So I was like, well, we'll try it. And they've loved it ever since. And I loved watching them. And then I had an opportunity to try it, and I tried it, and I liked it, and it's been great for the family. And so we keep doing it.
Yeah. Well, yeah, 8 years as a martial artist, that is a long time. When you think about it takes three or so years to get a black belt and then to continue on after that. It's a real dedication to the sport and the art of it. And that's one reason I really wanted to have you on today, because of your science background, and then also being a participant yourself. You have a very unique perspective on how martial arts is beneficial. Not, you mentioned signing up your daughters for character development things that you wanted, more self-esteem, more self-discipline, that sort of thing. But from your perspective as a doctor, what are the physical benefits as well to martial arts? So I just have a couple of questions for you. But since you do have a science background, what got you interested in martial arts from that perspective?
Right. So my background's always been in science. It's which science for me makes sense. It's black and white. And so all of a sudden we get into this martial arts, which is definitely an arts perspective. And I honestly feel like it was something that I was missing in my toolbox as a physical therapist in helping my patients. Um, and I've seen what my kids have, how they're growing up to be good people, and they're just much more well-rounded. And so the arts, especially martial arts, has really brought in a whole new perspective for me, and not just the physicality about it, but also the emotional impact, the mental impact, the spiritual impact. And when I work with patients, it's the same way. We're not just treating a knee, we're not just treating a foot, we're not just treating a diagnosis. We're treating that person, because every diagnosis affects people differently. And so we need to treat the person as a whole. And sometimes, honestly, I have a lot of knowledge in helping people get better, but sometimes they just need a cheerleader. Sometimes they just need a different perspective. Sometimes they need someone to get them on the right track mentally. And that's a part of my job. And martial arts has really helped me expand in that area. And I think my patients are really benefiting from it.
Wow, that's really cool, because it does sound exactly like a lot that we do, because you can teach the physical part of it, of how to do a punch, but then to help somebody get past the mental block of using that punch to break a board, you
Right.
know, or doing it fast enough to earn a point in a match, you know, getting past that mental hurdle of, what can your body do and how far can you push it? And I know from, just as a patient's point of view, from you helping me with different things, just your ability to say, okay, now it's time to go ahead and move forward. You're
Right.
not going to hurt yourself by, you're going to feel it. You might feel some tension or stretching or even a little pain, but you're going to be okay, and you're going to get beyond this. It's okay to push yourself forward. So that's one of the things I remember, as you helping me through some different things. And that meant a lot to my mental state, because it was like, I remember, I had an ankle injury and I was afraid to use that ankle. And I think it was causing me other pains, throughout the rest of my body. And when you worked on it and told me that it's okay to use it, it was almost like it was just the pain lessened immediately, just as I started working out again. And, so just that mind over matter. And you're right, it's the whole person. It's the body and the mind. So yeah, what a great match of skills to have. So, I don't know if I mentioned, you did you have been training and consistently training for 8 years, but you are a third degree black belt, and that's, I want people to know that, so that as we are talking, they know that you come with this perspective, not just from dabbling in martial arts, but you are, an expert and proficient at it. Not many people make it to third degree black belt. So I want to let people know that too. But yeah, what a great thing to think about, the mind and the body, which in martial arts we think about all the time, but bringing that to your practice to help people. So that's
Right.
great. So speaking of that, how martial arts is mind and body, what have you found, maybe on a personal level, how martial arts has helped your mind?
I think about that now, and it's really, really interesting, and I can really bring this back to my patients. But I know, for instance, I can't kick as high as a lot of people. Of course, I started a lot later in life, so I can't kick as high as people. I maybe can't move as quickly as other people do, especially like with sparring and things like that. But I think what I bring to the table, and I've just realized this now, is that it's that mental toughness. It's that mental strength. And I look back even over my career, not in PT, but just as an athlete as well. If I had that back then, how much better I could have been.
Mm,
So that's one of the things that, sometimes physical capabilities aren't your limiting factor. Sometimes you can get even further with it, just with that mental strength. And so I try and instill that in my kids, and trying to help them push through things. Okay, come on, you can do this. You can make it through this. Because like I said, when I look back, I think, man, I could have been so much better if I had just had that mental strength to push onward. So same thing with a lot of my patients. And I see that with especially patients who have had very debilitating either trauma or diagnoses, from spinal cord injuries to strokes to, Parkinson's disease and MS, and all these things that are very debilitating and can take you down physically. And for some of these people, it's the hardest work they've ever had to do in their lives.
mm,
So it's not just physically draining, but it's mentally draining, it's emotionally draining. And to help them get through that, and to see that perspective of, you know what, I can help them physically, but if I'm not helping them from those other perspectives, we're not going to get them there. And,
right.
and I think that's been huge for me with the martial arts, seeing that, okay, maybe I can't kick as high, but maybe I can do this, or maybe I can do that. And really, I can't put that all on me. It's on the other people I've been sparring, because they're like, oh, I'm afraid of you to do this. I'm like, why are they afraid of me? I don't know. I'm, a lot higher, and they're a lot fatter, and they're a higher belt than I am. So it's, listening to that and taking that in perspective, it's been such a great journey for me, as a person, as a mom, as a friend, as a daughter, and as a physical therapist. I think overall it's just made me better.
Wow, that's amazing. I appreciate you sharing that and being so open with everybody, because I see this happening in students, and for you to verbalize it so well, and to let a new student watching this, a new mom that's just started martial arts, or anyone, wow, that's going to happen to me. It's very inspiring. And I see it. You talk about the difference in the mind and the body, and I have seen it, because I've been teaching for over 35 years. Now I'll tell my experience. But seeing it over and over and over again, the student who comes in, no matter what age they are, they come in and they have the mental toughness to never give up, and they push and they push. And maybe they didn't have this great physical skill to start with, or a natural coordination, or a natural athleticism, but because they stuck with it, now they are great martial artists,
Right.
and they have learned so much. And knowing that it really is so much more the mind and the dedication than the body, you see that. So yeah, for your patients, I'm sure absolutely the same thing. So talking about the body, what from your perspective, what happens to somebody's physical body when they start a martial arts, or trained in martial arts for a while? What are some of the things to look out for maybe, and what are some of the benefits?
Sure. Well, it's not easy. And yes, I'm sore. I still get sore every once in a while when I'm trying new and different things.
Yeah.
So, but again, it's that pushing yourself, pushing to that limit. So, but the other thing is, which, I look at a lot of the different martial arts, and they're different entities, and they stress different things. And it's made me realize I've actually incorporated it with my patients, but there's balance, there's strength, there's coordination, um, there's endurance, there's so much physical work that I didn't really realize. And I think one of the reasons is because when I watch you guys make it look so easy, and then I'm like, oh my gosh, what is this? Flexibility, and a lot of things that are helpful.
Mm-hmm.
Oh, um, so
How,
that's
how, oh, go ahead. I'm sorry.
yeah, so that's been a big eye opener. I didn't really realize it, and now that's one big reason why I like it is I get a good workout.
Yeah, absolutely. Yeah, I think that's part of the mental thing too, is you do get a great body workout, and because you're thinking of all the mechanics of it and what you're doing, sometimes you forget that you're working out, and then you realize you just did, 75 lunges working on a specific stance or something.
Right,
So,
right.
so that's kind of nice too. What are some things that maybe people that are just starting martial arts need to be careful of if they're just getting started?
Right. And again, I'm guilty of this, but it's difficult to not try to stay up with the pack, with the
Mm,
class. You don't want to be the last one finishing. You don't want to be the only one in there who doesn't know how to do that, who can't kick their leg up as high, who can't jump as high, who can't, so you don't want to be, at least I didn't. I don't want to be that person. I still
right,
don't, but it's okay now, because now I have to look at myself and what my body can do. Because if I don't limit myself, then I know that I'm going to get hurt.
right.
Um, then I can't work with patients.
Mhm.
So that's a big thing. It's just I have to realize what I need to stay within, and then the big thing is I just challenge myself rather than comparing myself to him or her or whomever it is. So whether they're a white belt or whether they're a 6th-degree black belt, everybody has their own strengths and weaknesses, and so then that's the hardest thing for me. I should be able to do that.
I really couldn't agree with you more. Everybody has their strengths and weaknesses, but I think human nature is just to latch on to what our weaknesses are and forget
Right.
about what our strengths are. So that's a very good point to keep in mind. Look for what you are able to do. And, you know, less than 1% of the population even does martial arts. So if you're out there trying, you know,
Right.
you're way ahead.
And figuring out what your goals are of it as
Hmm.
well.
Good
One of
point.
the big things, my big goal at first was just to be able to bond with my kids, be able to do something with them. You have family day on Saturdays, and so we go Saturday mornings and we work out together. It's getting a little more challenging because my kids are getting better than I am and everything. But I can still take them down every once in a while.
I understand that 100%.
I bet you do. So that's a big thing because we can talk about things. And you know what? I haven't mentioned this, and this is huge. I think growing up, I always felt like failing was not an option. And I always had to do well. I always had to excel. And this has really provided me a great lesson in that it's okay if I don't do well in this. It's okay if I fail, because what it teaches my kids is that I'm still trying.
Mm,
And not just that, but even though I'm old, I can still learn things.
yeah.
And I had a mentor in therapy tell me a long time ago, Kim, you can't let your limitations limit your patients from getting better. So if I'm not always trying to keep myself healthy, then I can't take care of my patients. And for some of my patients, I'm their final hope. I'm not patting
Hmm.
myself on the back. It's just they've had a stroke or a spinal cord injury, and they need me to be able to help them up and to be able to
Right.
help them walk and to be able to help them move. And if I'm slacking on my part, it's their life that I'm affecting. And
Hmm.
I can't do that. So martial arts is great, just like physical therapy. There's always something to learn, always, as long as I'm willing to keep an open mind. And the same thing in martial arts, I'm always learning something new. And I might not be great at it, But that's the other thing is I just have to keep practicing.
That's right. That's right. Very, very good points, especially about uh, staying open-minded and continuing to learn, because that's our job as leaders and, older and wiser people. We want to be able to pass on some good stuff. So we have to keep learning. Um, let's see. One last question. You are familiar with a couple of different types of martial arts. So you're third degree black belt in Taekwondo.
Yes.
But because of your daughter's trainings here and different things that we offer here at the academy, we do offer Tai Chi, Jiu Jitsu, and weaponry. And you've had a chance to work in those, in different capacities. So when somebody's looking at starting a martial arts, and since you have some information on the different types, what information or advice do you have for people in that area? Like, if they're looking for this, which martial arts would be a better thing for them to do?
Right, right. So with a lot of my pediatric patients, I send them your way, especially for like Taekwondo, because the Taekwondo really works on balance, it works on speed, it works on strength, and they're moving quickly, and the kids like that. And you have padded floors, that helps too. So they can try different things.
Yeah, good point.
I really like Tai Chi for a lot of my patients. It's a lot more challenging than it looks. And so like for instance, the Tai Chi walking, it's slow, but it requires a lot of balance. It requires a lot of control. I like that for my patients who are maybe not the greatest with balance. I like it for, well, all of us getting older, we know that our balance starts to decrease. And so Tai Chi is really, really good with that. So I like that a lot. The jujitsu I like is a little bit lower impact than the taekwondo. So I like that. I also liked it, when we have two girls. And so my youngest really wanted to get into jujitsu. And my husband was like, oh, they're too close to body. They're right into your personal space. And I'm like, well,
Yeah,
first of all, your personal space is a lot different than my personal space. Like my personal space is like here, and
yeah,
his personal space would be too many people with just one person in the room.
yeah,
So I like that in that for them, and I told my husband this, if they get attacked, they're going to the ground. They will be taken to the ground at some point. I would like them to be able to get out of that.
yeah.
So that was a selling point for us. But the other thing I think with the jiu-jitsu was, like I said, it's a little bit lower impact. There's not as the jumping and the hitting things as much. So joint wise, sometimes that's a little bit better. However, if you're looking for flexibility, I think that might be very, very good.
Yeah,
So
I think it's a benefit. Mm-hmm.
and then the
Well, and
weaponry.
that's kind of like what you're saying is, sometimes if you want all of it, you have to try all of it.
Right, right.
Kind of like with your physical therapy, being, the body part and the mind part. If you want to be able to heal one of it, you need to work on all aspects of it. So that's a
Absolutely.
good point. Um, well, we are just about out of time. Do you have anything else that you'd like to add? I think this has been extremely beneficial for anybody who is taking martial arts, who is interested in martial arts or thinking about taking it. One, you don't have to be just a kid. So that's a really good point.
Maybe a
Okay.
kid part, right?
A kid at heart, right? And two, some of the things you might be looking for with the improving mind and body, you've given us some great insight on that. So is there anything else that you'd like to add before we have to end our meeting?
I just think that it's been a nice adventure to have the science and the arts mesh the way that they have. And it's interesting to look how far back martial arts goes, because physical therapy doesn't go back that far, but the years and years go back. And I played soccer for a while. I played semi-professional soccer, and I was watching a Pele video a couple months ago. And you know that they when Brazil and South America was being invaded, the natives were pushed into the jungles, and they weren't allowed to perform their martial arts, and so they hid it in the sports, and so they hid it in, one of them was in soccer. So a lot of the soccer moves are martial arts moves that have been just hidden in the sport so they could continue training with it. So
It sounds like you like to study history too.
Yeah, so the big thing is, it's been around a long time. It incorporates a lot of different things, and it makes sense to me from a movement perspective. So anytime I can get some of my patients over there, I try and get them your way.
Well, as much as I hate to say it, we've sent you quite a few. Because mostly because of that part you said about trying to keep up with somebody else, you know. So, but that's good.
That's
Well,
your
thank you.
limit, right?
That's right, right, and help people learn what their boundaries might be.
Right, right.
But well, thank you, Dr. Countryman. I really appreciate your time today, and it's been very helpful and very informative.
Thanks for having me. I really appreciate it.